Good evening, everyone. I'm Rico, a student at UPM. It has been estimated that the traditional messaging campaigns reach less than 10% of the targeted population. On the other hand, social media has been widely studied in the health and medicine from 2003 to 2017. Hence, today I'm going to talk about how health communication via social media is effective in educating the public. I believe that health communication via social media can make great positive impact in raising public's awareness on certain health issues. This presentation will be divided into two parts. First, we are going to look at how social media can be harnessed to best achieve public health outcomes. Then, I'll talk about why we should choose social media as our medium to promote health-related knowledges. Let's start by talking about how social media can be utilized to benefit us in health education field. Professionals from the field of medicine, sociology, psychology, public health, and communication can all work together for national and regional organizations to provide individuals with up-to-date and evidence-based health information. This is proven to be possible as many public health organizations, such as the United States Centers for Disease Control and Prevention, the U.S. Food and Drug Administration, the World Health Organization, the American Public Health Association, and others have established a social media presence. Health communication via social media became even more reliable when the World Health Organization specified accuracy, availability, balance, and others as attributes to consider in their health program. This is not only dominant for international organizations. As for an analogy, the Medical Directors Forum is a social networking site for medical directors that provide a verified, secure, closed-loop environment for peer-to-peer interaction. The resources on this site include a comprehensive library, discussion groups, calendar postings, and alerts. Also, because of the rapid development and the diversity of web-based applications, the media richness of the internet has dramatically increased. For example, interactive applications on websites like real-time text-based chat or even face-to-face video call can be made available, rather than just creating websites that only existed out of static words and pictures. Now I've talked about the role of social media engagement in advancing public health communication work, so let's move on to the next point. And I would now like to talk about why social media is seen effective in promoting health-related knowledge. As we know, the obvious channels for health-related knowledge are doctors and other health professionals. But from a user's perspective, this is not the most accessible or convenient way to obtain information. Hence, through social media, we can target and reach diverse audiences. Just as some audiences may prefer to receive health information via print materials or from their peers, some audiences prefer to receive health information and communicate with public health organizations online, which can be done anytime and anywhere. In fact, 59% of US adults who use the internet reported they have looked online for health information in the past year, with 35% indicating that they had gone online specifically to understand an emerging health condition. This shows that the number of social media users has been steadily growing. The social media presents an opportunity to reach audiences who may prefer to receive health information through these channels. Since we have looked at only one reason why health communication via social media is effective in educating the public, now let's turn to the next point. The next area I would like to focus on is that social media is able to update the latest information from time to time. Social media can help facilitate information sharing during normal and seasonal health events and health crises. Public health agencies and other organizations can use social media to disseminate time-sensitive health information, promote information sharing to encourage behavioral changes, be a platform for conversation between agencies and constituents rather than just an information provider, and allow the public to provide useful information and feedback. Professionals can also provide corrections for audiences, about the untrue rumors about healthcare that can be found commonly online. Experts can also listen and collect feedback in real time so that they can learn more about our audiences by paying attention to social media conversation at the aggregate level as they are unfolding in the real time. Social media monitoring tools allow public health organizations to learn more about what diverse audiences are saying regarding public health topics, identify information gaps, and adjusting messaging accordingly. Now we are done looking at how social media can provide the latest information to the public. Let's summarize what we have looked at so far. Firstly, we have looked at how social media can be used as a tool to promote health-related information. Then we talk about why it is considered as one of the best ways to spread the knowledge. So now you can try searching on social media should you have any inquiries on healthcare. Thank you.